to the Mobile County Health Department.
And so these are really staggering numbers. It has really accelerated in areas across the U.S., mainly in New York, New Jersey, Louisiana. So we continue to keep an eye on what's going on globally and nationally, but let's talk a little bit more about what's going on in Alabama and in Mobile County. So in Alabama's reporting 2,881 confirmed COVID-19 cases on their real-time dashboard. It's probably gone up even since this document has been printed, and 79 reported deaths. In Mobile County, we saw 106 new cases added since yesterday. So our number is now 356 with 10 reported deaths, 9 of those being related to COVID illness. I believe in the next couple of days you may see some changes in the way the Alabama Department of Public Health and Mobile County is reporting information on the number of deaths. There has been a little bit of confusion about what a reported death means and how is that different from someone who died with the illness. And I think to be more closely doing business the way other states have been doing it, we may see some changes of that over the next couple of days going into next week. So let's see. I wanted to talk a little bit about the weekend. It's Easter weekend. We have severe storm warnings for Sunday, so please keep an eye on your local weather sources for guidance about severe storms that are possible on Sunday, with a variety of storms, thunderstorms, potentially some tornado risk, that sort of thing. So please keep a good eye on that. And also, since it is Easter weekend and folks are probably starting to get itchy, just to remind you that we have a sort of a stay-at-home order, and in the city of Mobile, at least, some curfews. So we just want to remind retailers and shoppers that you need to sort of follow the recommendations that CDC has put forth out for reasons of buying essential supplies, or taking care of a family member, or going to a medical visit. Again, a face covering can be a piece of cloth, maybe from a t-shirt, or a thin blanket, or some bandanas or other cloths that you have around the house. You can make them your own. We want to emphasize that a face covering is different from a face mask or an N95. So we still want to preserve face masks and N95 for our healthcare providers. They're the ones that need those supplies most. And there's instructions on the CDC website for sort of building your own face covering, or sewing one, or maybe even just using 2 rubber bands and a piece of cloth for making your own face covering. But also, retailers and shoppers, remember that in addition to the face covering, you need to be physically distancing yourself. So, don't come within 6 feet of other people when you're in a retail setting. Sanitize carts, wipe down disposal containers, and touch surfaces frequently. Just want to make sure that you're washing your hands and using hand sanitizer when there's no soap and water available, to really make sure that we're reducing transmission of COVID in our community to the greatest extent possible. The reason for recommending a face covering is not to protect you from someone else. It's in case you don't realize that you have an infection with COVID. So as we've talked about before, we've learned more and more in recent weeks that there is potential contagious viral shedding among people who are asymptomatic or pre-symptomatic. So that's the recommendation for the face covering, is that if you are out and you don't realize that you have virus circulating in your respiratory system yet, you will be protecting others from yourself. So we're trying to limit that potential spread from asymptomatic or pre-symptomatic people. So let's see, I've got a couple other things. Dr. Eishold, our health officer, wanted to just sort of remind community members about sort of the history of public health, and that people these days are living longer due to vaccines that have been developed to protect us, and Sometimes we get a bit complacent. We take our good health for granted, but just as a reminder that, there is no vaccine for the virus that causes COVID-19, and we need to continue following the recommendations of the Centers for Disease Control, our state public health partners, and the medical professionals to really flatten that curve. Really, again, flattening the curve means that we're slowing the spread of the virus so that we don't overwhelm our hospitals and other healthcare providers with a surge of cases all at the same time, because that will lead to even more negative outcomes. I think I've done that. I will give a little bit of information. I just want to clarify something that we have begun to talk about. We have a daily report that comes out talking about the characteristics of our COVID positive patients. So, how many are hospitalized, how many have died, looking at the age categories. And really this is to inform you and to form our authorities and to guide messaging to the populations that are at greatest risk or are experiencing the highest number of cases or severe complication. And so one of the things we have begun to report on is providing a little bit more information on the cases that require hospitalization. So today we reported on 44 people who required hospitalization with laboratory confirmed COVID-19 disease. 3 were between 25 and 49, 16 were 50 to 64 years old, and 25 were at that 65 or older age category. And among those patients, those hospitalized patients for which we have information, 27 were male, 17 female, 33 were African American, and 11 were white. We're not able to provide information on other racial and ethnic backgrounds because those numbers are really very small, and we again are trying to avoid inadvertently revealing an individual who has disease. And so for our deaths, the 9 deaths that we reported on today, all who died with COVID illness, they were between the ages of 52 and 78. 8 were male, 1 was female, 6 were African American, and 3 were white. But just a reminder that they each had underlying medical conditions, they developed symptoms typical of COVID disease, and they were hospitalized at the time of death. The reason we want to give these sometimes grim statistics is we want the community to remember that this is a real threat. We are in a situation of, community transmission. It's no longer just people who have traveled, and we need you to take the stay-at-home order, the social distancing, and cough hygiene and hand hygiene seriously. We need you to continue following the advice of your public health authorities and your elected officials, so that we can again try to slow the transmission within our community, so that those who are at greatest risk of complications and death will get the high level of hospital care that they need, and we don't overwhelm the system, which could lead to additional complicated illnesses and deaths. So that's the reason that we're starting to share with you a little bit more information on our hospitalized and our hospitalized patients and the decedents who have unfortunately passed with COVID-19 illness. So with that, I will answer a couple of questions. Mark Bryant is here today, 6 feet away from me, to ask these questions. So go ahead, Mark.
There were numerous employees at a local medical center who tested positive this week. Are there any other spikes at any other medical centers?
So first, let me address the reports of positive cases. We get a lot of people call us or email us to say, we heard this person's positive, or we heard there's this many at this hospital that are positive, and we heard something somewhere else. And often when we try to try to run down those things, they turn out just to be rumors or a misunderstanding about the test result. So I just want to remind everyone that a laboratory confirmed person with COVID illness are the numbers that we're reporting. We often hear about people who think that because they've been tested or been given a note that they can go home for 7 or 14 days, that means that they're positive, and it's not always the case. About having clusters of COVID positive, in healthcare facilities or congregate settings like detention centers or group homes. We have several investigations of disease, COVID-19 disease, among residents and healthcare workers at several facilities and homes around the county. And we are investigating all of them carefully. It's quite, as you have seen our case count go up, we're getting lots of reports every day, and so these clusters will continue to happen. I can't speak directly to the one facility that maybe is mentioned here, but we do know that there are clusters or groups of people with similar illness showing up in facilities that have, people in congregate settings.
Okay, they saw the 106 case jump in one day. Is that because testing and processing is ramping up?
Yeah, I think that this week we have seen an important shift in laboratory testing. We're starting to see those promises of having lab results within 24 hours are starting to work. So we haven't talked to all of the commercial labs, but we know that some have stood up more capacity for testing. And so yes, those high numbers that we see this week, we think it's multifactorial. We think it's partly due to more testing availability in the labs. A new lab in Mobile stood up just this week, and they have 24-hour testing, so that's part of it. We have more testing being conducted around the county, so that's part of it. And then I think part of it is influenced by these clusters that we're beginning to see in congregate settings. So we are working hard. I'll be working hard over the weekend to try to tease out these clusters where we have many people who are getting disease from one or two positive patients in a congregate setting. It's really kind of driving our numbers up. So I'm going to be trying to tease that out because we really want to know what COVID looks like, just person-to-person transmission in our community. And then we sort of think about these congregate settings, hospitals, nursing homes, detention centers, those kinds of things that have outbreaks within their facility. We think about those a little bit differently. So we're trying to tease that out, Mark, so that we can understand. But yes, that 106 in one day, partly testing availability, partly the testing coming back more quickly, and partly just a rise in the number of cases.
Is the health department looking at any kind of data to measure compliance with social distancing rules other than infections? For instance, the Alabama Department of Transportation says traffic along I-10 is down 40% in Alabama.
Yeah. I've been driving, and I can tell you from personal experience that the traffic on I-10 is definitely reduced during this stay-at-home order. So at the health department, our charge and our responsibility is conducting surveillance for cases and doing contact investigations to make sure that those people are staying at home throughout their quarantine. We right now are not looking at other indicators that might demonstrate a successful social distancing policy. I've got my eye on the ball that's been tossed to me, and that is on tracking the disease itself for now.
This was one of our Facebook followers. They were riding their motorcycle the other day, and the person in front of them, the stoplight, was smoking a cigarette, and the secondhand smoke came over the motorcyclist, and he was wondering if there's been any studies that say COVID-19 can travel on secondhand cigarette smoke since it was coming from the person's mouth.
Yeah, I've not seen any data to support that, but I'll take a closer look maybe. Interestingly, smoking or former smoker is one of the underlying conditions that we ask about when we interview patients that have tested positive for COVID-19. Right now, it's still pretty early in our analysis, but we're trying to evaluate, first of all, are smokers at greater risk of infection because they have limited lung capacity. But I don't have any reason to think that you might have been exposed to live virus through inhaling secondhand cigarette smoke.
And the last one, someone said the Johns Hopkins University, their dashboard has a listing for number of recovered patients, but they don't see that many places else. Can you explain why, like our dashboard and the state health department dashboard doesn't really list that?
Yeah. The reason that we're not able to provide that information right now is twofold. First of all, it's very early in our outbreak. The duration of illness can be just a few days or could be many days or weeks if a patient with COVID is hospitalized. So right now we are only able to focus on, we have 9 investigators that are conducting case investigations right now. And that's up from 2 that we had just a week or 10 days ago. So we have surged to try to meet the demand, but we are still just trying to keep up with investigating the number of cases that we learn about on a daily basis. It just keeps going up every day. At this point, we are not able to get back around to find the time to calling back the 356 cases that we have and asking them how long their illness lasted, and have they recovered, or did they have other adverse outcomes. We just don't have the capacity for doing that right now. We are talking about options for surging, maybe using medical students or public health students or other personnel within the health department to conduct those interviews where we would be contacting patients again, COVID positive patients again, to find out about their outcomes. It's a pretty lengthy process, and right now we're just using all the manpower we have to try to investigate the large number of cases that we're getting every day. I mean, this is what our curve looks like. So for the last 3 days, we have added between 75 and just over 100 cases each day. And so we are working as fast and as hard as we can to get those cases investigated. Anything else? Anyone? All right. Have a great Easter weekend. And again, thank you for the part that you play in keeping our community safe. And we'll talk to you again on Monday.
Thanks for joining us here on Fox 10 News. I'm Chelsea Sayasan. Now, we were just listening to Dr. Rendy Murphy with the Mobile County Health Department. She stressed the importance of wearing a face covering when you're doing an essential task like shopping. Now, she says to save those face masks and N95 masks for healthcare workers, and there is no vaccine yet, so staying home is vital right now. Now, Dr. Murphy says 44 people have been hospitalized because of COVID-19 in Mobile. We will be right back at 3 p.m. with the Mobile County Sheriff's Office. The city of Mobile will not hold their daily press conference today in light of Good Friday. We'll see you in about 10 minutes.